Good morning. Okay, let's get a little sound check. Check, check, check. Okay, let me see here. Let's see it. Okay, check, check, check. Okay, here it is. Let me see here. Okay. Sound check. Thank you. Yeah. Sound check. Thank you. Okay. So everything is all set. Sorry I missed you last Saturday. Last Saturday I had another program. Today it's a very important class today. Today's class is your yoga therapy daily routine for maintaining health. The most important thing here is that if you practice a yoga, and especially yoga as a therapy, which is adaptation of the yoga practice, you will have definitely a benefit from your lifestyle related disorders, what we call metabolic syndrome. Diabetes, hypertension, coronary artery disease, dyslipidemia, your depression, dementia, Alzheimer's disease, truncal obesity, you name it, there will be improvement. But then you need to maintain what is called a daily routine. So if you do a daily routine, what you will get, what is called maintenance of health, and in yogic language, Sanskrit, it's called SWASTHYA RAKSHA. See, health is a SWASTHYA. SWASTHYA word comes from Sha means self and Sthir means stillness. Stillness of your body, mind and spirit. Balancing your body, mind and spirit. These are the real definition of health. Now, I get this question all the time. I know everything, I'm not motivated, I cannot do it daily, what should I do? My answer is very simple. For all of your lifestyle related disorders, you are taking a medication every single day. So if you don't forget how to take your medication, and you can do just very few minutes, or incorporate this daily lifestyle in your routine. So I'm going to show you all the things we do for our daily lifestyle to maintain our health, and which we've been doing for years and years. I don't miss a single day. It doesn't matter where I am. I may be here, I may be overseas, I'm in a train, I'm in a plane, I'm in a car, but I really do not miss a single of my daily routine. So let's start with a whole day routine. Wake up in the morning. Yoga and Ayurveda says wake up in the morning between 4 to 6 a.m. 4 a.m. to 6 a.m. The time is called your Brahma Samay. Okay, let me say it's a time for our Supreme Being. And we have noticed in our Ayurvedic tradition, it is a junction of your Vata and Kapha. So your psychophysical energy, which is a mobile and which is your grounding. So that is the best time to wake up and start practicing. When you wake up, we sleep, called yogic sleep, and I have shown you many times how do you sleep. You sleep like a baby. Baby sleeps, if you see, with their feet together, knees on the side, which is called Supta Baddha Konasana. If you've never noticed a baby, take a look at a baby. Baby will put their feet together and knees will be outside, and that's the way they let out. Sleep like a yogi. Yogis sleep on the left side on your okay, I better show it to you. And I mean, you have all seen, how to do it, but let me show it to you so you will appreciate. Yogis will sleep on a left side on a fetal position. On a fetal position, and how to get up from the sleep. So I will show you everything. I just in a mat or in a chair, so you will appreciate all the practices. Okay. So say two people who sleeps well. The first one is a baby. Sleep like a baby, sleep like an infant. You will sleep how the infant will sleep. An infant will sleep. Always remember, when you put your head down, be sure your chin is below, it's not way high up. If your head is like this, then put a little pillow. And remember, your whole practice is an effortless ease. So let's see if you have noticed the baby, how the baby sleeps. Baby will sleep their feet together, put it down, and in the hand, what they use called a Balo Mushti Mudra, baby fist. They take their thumb inside, they close, they put the hand down. Oh my God, that's asleep. We personally start our sleep this way at the beginning. If you have a little issue, you can put a couple of pillows under your knees. Initially get supported, but then you will get used to it, and it's a profound level of relaxation, and your so let me start, since I'm in the mat now, that at the end of the day, we go to bed around 10 o'clock at night, and I'll show it to you what we do before going to the bed. We do a lot of things before going to the bed, but when we're in the bed, first we sleep like this, like a baby. Then we will do the baby breathing, called abdominal breathing. When you breathe in, abdominal wall rises high up. Breathe out, abdominal wall goes in. Abdominal breathing is relaxing, it's a parasympathetic. We do it about a few times, and always do it with your effortless ease. If you have any effort, don't do it. Then you practice a breathing with the breath holding. Count of 4 in, count of 8 out, count of 5 in, count of 10 out. Breath holding longer than breathing in, breath holding in inhalation, which is the activation of the vagal tone or activation of parasympathetic tone. All the concept of polyvagal theory, it has been shown. The yoga is practicing vagal activation all along. After the holding your breath, you get a sense of your called CO2 narcosis. The carbon dioxide in the blood gives you a sense of narcotics. Initially, your body temperature is high. So you sleep, the yogis sleep initially on the right side in a fetal position, and generally they put a hand and they put the head on the hand. If you can get used to, you'll be able to put your head without your hand. Left nostril breathing is cooling. It is going to balance the temperature of either body. After a short time, you turn around and we sleep on your left side. In a left fetal position, if the hand is down, we use again hand like your Bala Mushti Mudra. Put it here. If you feel little uncomfortable, you can always use a small pillow. You can use a small pillow under your head. Have a Adhi Mudra or Bala Mushti Mudra, which is a powerful relaxation of your hand and upper part of the body, and sleep. In a deep sleep, body core temperature comes down, all the muscles get relaxed, and the right nostril breathing being hitting is going to balance the inner cold temperature. It also prevents any pressure from your inferior vena cava. Inferior vena cava is the main channel which is carrying the blood to your heart. So the blood return to your heart became unobstructed. You get a better preload in the heart. That means more blood coming into your heart. With the relaxation response, you get a reduction in the afterload. The heart doesn't have to pump hard for the ejection fraction goes higher. So in the morning between 4 to 6 when you get up, we generally get up between 5, around 5 or maybe at best 5:30, and it's automatic. We go to bed by 10, 10:30, wake up between 5 and 5:30. Initially stretch your right leg, put a little bit of support, and you sit down. If you're sleeping on a mattress, do not get up right away. It's a we call principle of 90 seconds. 30 seconds you sit down in your bed. What happens at night, all muscles are relaxed. The moment you get up, all the muscle contracts and make you a little stiff. The blood pressure which we had in laying down was a little lower than a regular blood pressure. When you get up, blood pressure gets a little higher to maintain our perfusion. So you need to give it time. If you don't give the time, you develop what a postural hypotension. You get up, you get a blackout spell, all the heads are spinning. Then stand up next 30 seconds. And then slowly walk for next 30 seconds before you become properly mobile. So rule of 90 seconds, if you follow, then what happens? You protect yourself from the most disaster in our senior living. It's called fall. Balance comes back, prevent yourself from fall, and also at night when you need to get up, if you're a senior person and people, especially male, with a prostate problem, they'll get up 2-3 times at night. Be sure the path is lighted. Don't count on your memory. I know the path, how to go to the bathroom. Please, no. Keep your lighted. Turn the lights on in the bathroom before you go to your toilet. Fall is the #1 killer for the senior people. For us, first thing when you get up in the morning, we'll sit down in a squatting position. And let's see what we have. We have here, okay? Sit down in a squatting position. And in the squatting position, what it does, if you see, it relaxes your knees, relaxes your ankle, your feet, your hips, your back. Essentially, your whole body gets relaxed. So we keep a glass of water in our bedside, preferably in a copper vessel, and we drink that glass of water in a gulp. Gulp means take the water and then take it, sit down properly, okay. So in a gulp, you are going to, what it does, it initiates your peristalsis. So here you are going to have a proper bowel movement. Generally, for us, we prefer about a couple of glasses in a room air. People always ask me whether I need a warm water, cold water, hot water. I always say the body is functioning at a body temperature which is close to the room temperature or maybe a little above. So don't push anything other than your normal physiology. Put your elbows in the inside, hands separate, with the hand get relaxed, bring it close, keep your spine straight, close your eyes and breathe out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. The whole gastrointestinal system is supplied by parasympathetic nerve, and when you're able to sit down in a squatting position, which is called a malasana, and basically this is the asana for your excretion, your pelvic floor is all relaxed. The muscle which is a pull to your anorectal junction between the rectum and anal canal, which causes a little kink to prevent any incontinence. Muscle gets relaxed and within a short time you get an urge for a bowel movement. And go and sit down for a bowel movement. Now we have this, we sit down in the squatting pose, and for our toilet also we have called a squatty potty. So put the squatty potty around your toilet, and generally you sit down like this. Squatty potty comes in a 6-inch and 9-inch. Then when you get up without a support. Able to get up without a support is your sign of health. And I have shown you many times how to slowly get down and able to get up without a support. If you cannot do it, you want to practice it, I still want you to practice. Suppose you're sitting in a chair. Sit in a chair. Sit in a chair, but able to get up without a support. So best way to do it, put your hands on both sides and able to get up and sit down. And literally, you keep doing it at least for 30 seconds to a minute. Breathing is your effortless, breathing is your normal. So breathing out longer than breathing in. I'll do it with my eyes closed. Wonderful practice, sit-down test. Oh, you might like to see what a squatty potty looks like. I have it here somewhere in my, okay, let me bring it to you. Just one second. Had it for years and years, you know. So this goes around your toilet, and you're sitting down like the way to do it, like you're sitting down in your toilet. It is around your toilet, and your feet goes high up like this. So basically, sit down in the toilet and you get the effect of relaxation of the pelvic floor, straightening of the anorectal junction, and get a proper elimination. After that, in yogic tradition, you clean. The toilet paper is not good enough. If you have something, if you get a mud, or if you get something dirt, you need to wash it. So washing with the water, and all of us, we have got a washlet. In washlet in our bathroom, and you get a, washlet is beautiful. You get a washing, drying of your rear end after a good bowel movement. Very, very important daily routine. The moment you carry that stool throughout the whole day in your colon, that is the worst health habit you will ever have. So what's next? After a good bowel movement, now it comes brush your teeth. So you get to brush your teeth. Initially in yogic tradition, there is a little branch of a tree. Many of the people from our Southeast Asia know it's called a neem tree. It becomes, when you open it up, it just the whole small branch, every fiber opens up and looks like it's a brush. When you brush your teeth, brush in a circular way from the side to the back, and then after brushing your teeth, most important thing, is massage your gum. In yogic tradition, they used to dip the finger in the little bit of oil, and generally they use a mustard oil and put the finger and massage all the gum, both above and below, and it gives you a gum health. And gum health is very important because all the problem in your teeth starts at the root of your teeth, and root of teeth is at the gum. Then you use a tongue scraper and scrape your tongue. Brushing your tongue doesn't help much. A simple metallic tongue scraper with very gentle scraping. You have a lot of follicle in the tongue, you don't want to hurt yourself, very gentle. And it comes, you can bend it yourself. I think we have some which is a settle, which is a pre-bend, which you can use. And also in a yogic tradition or Ayurvedic tradition, you use a different metal for your based on your doshas or body type. I have all these collectibles. I do collect things related to your lifestyle in yoga. Let me see what I have here. Okay, this is very interesting. You have a one with the copper, and copper is regarded as the real metal with a iron which you're supposed to be bactericidal, and a lot of even the hospitals are using copper impregnated clothes for their. So this is these are a bunch of different pre-bend copper tongue scrapers. Very nice. Another very narrow one. So after tongue scraping, after brushing your teeth, massaging your gum, tongue scraping, then comes your washing your nostril. Or for the men also, what we do now is the time of your shaving. And shaving is absolutely must in whole yogic tradition. You shave and then your neti part. Washing your nostril is a must in daily practice, and we say in the morning what you do. You wash your mouth, wash your eyes, wash your forehead, wash your head, wash your hair, wash daily shower, do everything. But most important thing you need to do, wash your nostril. So we start with a let's see if I can find one. Yes. So this is a neti pot, and now the neti pot you can find anywhere, any place, even the Walmart sells a neti pot. And I've shown you before. Maybe you can go to my YouTube video and find how to do the neti pot. So take the neti pot and use a little lukewarm water. Fill it up with the water. Then put a little non-iodized salt. What the salt does, it makes it like your body fluid. So you get a little, hopefully you get less irritation. Now, if you're traveling, when I'm traveling, these are porcelain, very good. Initially, you may have a little problem. Then the practice is you put a little bit of salt, generally about 3 pinches, and which makes it your like a body pH. You put in one of your nostril, and then on your sink, you slowly open your mouth, start breathing through your mouth, and turn your head, and you will see the water will slowly come down from the opposite nostril. Initially, the water is not going to come because it's a relaxation response. Initially, we will have a lot of irritation. You are very afraid that, where the water is going. People say, I'm afraid the water will go somewhere in my head. Yes, there is an opening above your nostril, which is called cribriform plate, which goes to your brain. We do surgery for your pituitary gland through nose. A lot of surgeries are done through nose. Even there is a reported that with the neti part, there is a amoeba. There is an infection, amoebic infection going to the brain. But on the other hand, if you notice, you are in public pool, you're dipping, you're taking a dip, and you have no idea what is going through your nose. Are absolutely resistant for your environment. Look at the air we are breathing. Look at the air we are breathing in Mexico City or in New Delhi, in India, or in different polluted places. Then you do it again on the other side of the nostril. Put it here and slowly turn your head, close your eyes, keep breathing. What does? It takes out your irritation. Then what it does, it controls, voluntary control of involuntary function. Remember this, if you're a physician, you're listening to it, voluntary control of your involuntary function. That means you are able to control your autonomic nervous system. You are able to control your parasympathetic tone. People who lives longer, 90 years, 100 years, you name it, maintenance of the health, is they're always in a state of parasympathetic tone. The sympathetic tone is less. Now, when you are carrying the salt, I had this issue. When you carry this white salt, this is your non-iodized salt. Iodine sometimes irritates a little bit. Carry it in a TSA approved container. The moment you have a white powder in your hand luggage, guess what? That's going to be thrown away. They are not going to taste it, they're not going to do it, they're going to throw it away. The moment it is in a TSA approved container, they generally don't bother it. When the people ask me when to do neti pot, we really don't tell you when to do neti pot. Neti pot is your daily routine. You are brushing your teeth, you're washing your nostril. Initially, it is so irritating. Your face will be flush, your eyes will be watering, but slowly and slowly the irritation will go away. And guess what? When irritation goes away, the blood pressure comes down. Blood pressure goes up because it's a emotion, it's a irritation. You go to your teenage kid's room, your blood pressure goes high up. Your boss screams at you, your blood pressure goes high up. So, even you stay calm in the middle of crisis. Mother-in-law doesn't bother you, your boss doesn't bother you. I also carry a plastic one when I'm traveling, because it's hard to carry a porcelain one in your travel. So I do not recommend the plastic one for daily routine, but once you're traveling, because I do not miss. And I tell you, I was just been to India, and when you do in the morning, neti pot, blow your nose, you see the thing comes out, you said, oh my God, I've been listening, I've been living with it all the time. I like the one like this shape. This is a very nice shape, porcelain one. I have a bunch of them, but this is very nice. There are a lot of fancy ones these days. One is very nice, like a fancy cup here. One is a colorful. Look at the blue color. It's a neti pot. But the most important one I just recently got, another sometime back, is a copper neti pot. The copper is big, as I said, being used in yoga and Ayurveda for thousands and thousands of years back, and this is copper neti pot. One thing I'm going to show it to you. So once you finish your neti pot, you stand, little bend, and because you have some water in your sinuses. So what you do a little Kapalbhati pranayama, pushing your abdominal wall so air comes out. So my hand is in Adhimudra, relaxation. So we'll do 5 with my head high up. 5, head down. 5, turning your head on the right side. 5 on the left side. Then you want sinus for like frontal sinus here. Then you just hit in the frontal sinus. Then you do a little bit of a Kapalbhati pranayama. But even after all this, you are going to have a little bit of a drainage from your sinuses throughout the whole day, especially when you do Bastrika pranayama or a pranayama practice. So again, we keep our little bit of a facial tissue with us to prevent the drainage. Okay. After neti pot, we also wash our face. Wash your face, wash your eyes, wash your head, and West, you can use some kind of cleansing for your face. I forgot the name. What is a foaming? There's a foaming liquid. CeraVe. CeraVe is a little foaming. You put a foaming there. Put a foaming. Put it all over. Yeah. Then take your shower. Again with a little lukewarm water. Go shower. After shower, you starts your daily practice. A daily practice, what you start first, we generally recommend, and we practice about an hour of daily practice. It's a 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Start with relaxation of the hand. Hand relaxation comes from your Adhimudra. Do not close your hand like this. Always put your thumb inside and close. Initially the thumb will be here, and then always incorporate your breath with your asana practice. If you have been following me in asanas, you know that you breathe out longer than breathing in. You do all the asana without any pain and with your effortless breathing. Remember, heart and lung is the same organ. If you put a little exertion into your lung, it will show up in your heart. According to breathing difficulties, you will have a heart rate will go high up, blood pressure will go high up, heart will show the heart is in a distress. Same way, when you put a little stress in your heart, it will show up in your lung, which will be effort in breathing. It shows like you have a effort in breathing. Another one is very interesting, is a squeezing ball, and these are it's like a tennis ball, but this has a consistency that it recoils back. Our hand needs to be in our normal physiological position. We get a lot, I get a lot of times, the little trigger finger. I don't know if you know what trigger finger is. It comes. This is called a tenosynovitis. You get an inflammation of the sheath covering the tendon, and your finger will be like it will just open up like that because it gets stuck. So you can put your hand and with your breathing, breathe out first, breathe in, squeeze. Breathe out, let go. See how beautifully it acts. Squeeze, let go, it comes back. Breathe in, breathe out. We also practice what is called a sutraneti. Sutraneti is a yogic tradition. They were doing it with a thread. What do we do with a little red rubber catheter? Actually, when I do the whole Dinacharya practice, I show it too in live. Initially, everybody said, "Oh, I don't want to see it. I'm going with my eyes closed." But they started doing it. They always come. See, there are your 6 practices called the Shat Karma to cleansing your physical body. Tratak, Neti, Dhoti. Dhoti is washing your stomach. It's very simple. People say, "Oh, it is a vomiting. It's going to hurt you. You're going to get a Mallory-Weiss tear. Your esophagus will, gastroesophageal junction will tear." No, it's all relaxation. Drink your water, put your finger here, the water comes out like it. So initially what you do, if you don't want to see it, it's fine. Keep your eyes closed. And I'm not going to show it to you either. You take this red rubber catheter, you prefer a 12, and put it in your nostril and slowly push it in. Initially don't go there, but if you put a little bit of a Vaseline, put a little Vaseline. Oh, same thing for neti pot too. So when you're using a neti pot, if neti pot has an issue, put a little bit of a Vaseline around, and it will fit into a nostril very nicely. So I do carry a little bit of a Vaseline. I don't know where is that. It's somewhere here, probably here. Yeah, I also carry, this is another TSA proof from your salt. Little Vaseline, it's there. So this is the whole thing I've been in my daily routine, daily practices. So put a little bit of a neti pot, put it through one of the nostril, and if you keep pushing it in, it will go inside, and then it will come out through your mouth. When it comes out through your mouth, you hold them, you literally floss your nostril. You have not seen it? Come to one of my demonstration. I'll show it to you. And if you want to see, you can go to the YouTube. And I have the YouTube Sutraneti in the YouTube. And you can watch them very easily. You should practice asana, your daily asana practice. Sitting down, standing up, face down, face up, and if you go to my how to start a daily asana in the YouTube, you'll see everything. But we do a daily pranayama practice. Asana practice, we can alternate, we can change, but we do a sequential pranayama practice. Obviously, first pranayama is breathing out longer than breathing in. Then I'm not going to show you all the practices because you can go and see what practice. We do a Bhastrika pranayama, but remember all the pranayama for yogic health, maintaining health, needs to be done totally in an effortless ease, as if it is your normal breathing. If any effort, you back off. Because the muscles of respiration are skeletal muscles. They will get relaxed and they will expand, and you will have a better and better. Initially, you may have a 2 second in, 4 second out. You can go easily 4 second in, 8 second out. You've been doing it for so long, we can do even 10 second in, 20 second out. Sit down in a chair. You can start sitting in a chair. You can start your practice. Sitting in a chair, you can do. Let's say your practice will say sitting in a chair. A primary relaxation. Primary relaxation will be your prayer pose to the back. So if you're able to put your hand to the, always remember when you sit in a chair, always keep your spine straight. If you sit in your kneeling stool, where I sit, your spine is always straight. You put your hands in the back slowly, and you're able to do your Paschim Namaskar, prayer pose to the back. You're able to sit. We'll take a look. Put your hand to the back. Slowly, you put your hands to the back and bring it up. Like a prayer pose to the back. So able to stay in the position and able to do all your asanas, this is good enough. And the moment you stay here little longer and longer and longer, which you will have this is a very simple asana. And start where you are. If you're here, stay here. We say in stages, impossible become possible. But this is going to be your normal posture, normal asana. And will come to you because of neuroplasticity. This will open your chest, and there will be a lot more expansion in your chest to cause your prepare yourself for your pranayama. So we start with the pranayama practice with the breathing out longer than breathing in. Then we'll be doing first a round of your Bhastrika pranayama. Bhastrika is the active inhalation, active exhalation. We start with a slow, then a medium, and then a fast. We do 20 count each. We do one cycle, then we repeat the cycle. You can go and take a look in the pranayama practice and see. After Bhastrika, we'll do Kapalbhati pranayama. Kapalbhati pranayama we do with all the mudras. We do the 10 mudras. And then we'll do the breath holding in inhalation, Mursha pranayam, breath holding in exhalation, Uddiyana Bandha abdominal lock. We practice all the 3 locks, chin lock, abdominal lock, and a root lock. Then you call it great lock. Locks are very important because they're basically activation of your parasympathetic tone. We'll practice the asanas to improve your elimination, which is called a Shankha Prakshalan, 5 asanas, Utthita Tadasana, upward mountain pose, Tirjak Tadasana, oblique mountain pose, Kati Chakrasana, moving your waist, then your Tirjak Bhujangasana, oblique cobra pose, and then a Udar Karshanasana or Shashankasana. Udar Karshanasana is your basically churning your stomach for a proper bowel movement. It is a big procedure called your Shankha Prakshalan. Shankha is the metaphor of the intestine, Prakshalan is the cleansing. You also do alternate nostril breathing, Anulom Vilom Pranayama. Then you do a breath holding. We do a 1:4:2 ratio, 4 in, 16 holding, 8 out. Then we'll be doing a Brahmari Pranayam to quiet down your mind, bumblebee breathing, Om Pranayam, and we'll do few Sitali, Sitkari Pranayam. But we do practice pranayam every single day. Meditation, it comes with it. When your physical body is prepared, when your physical body is completely in relaxation response, your breath is in an effortless ease, your mind goes to a state of meditation. In a state of meditation, you have all the thought process. We generate thousands and thousands of thought process. Most of the thought process are in the past, majority in the future, very few here. 95 to 98% thought process are repeat thought process. In a meditation, we enter in between the thought process and we slowly increase our gap. When the gap becomes wider, the thought process is still there, but our mind does not jump like a monkey and stay in a parasympathetic tone. We do the practice all with our health tracker so you can see what you are doing. After a good practice, go for a breakfast. Breakfast we do a little bit later because in the morning 6 to 10 is a kapha time. Kapha time, your digestive fire called Agni, it's called a Manda Agni. Digestive fire is not strong, so if you really want to do, have a good breakfast, which we really said, our way of looking at a good breakfast is maybe a nice oatmeal with a, a little oatmeal with a maybe a little yogurt in the morning. We eat dates. The dates is very, very important because it increases your ojas, increases your kaphas. We take a lot of nuts, walnut. The shape of a nut tells you, but walnut looks like your brain. And in fact, one of the name of the walnut is called a magaj. Magaj is a name for your brain. Almond looks like your eyes, so maybe good for your eyes. Pistachio looks like your kidney. Maybe it's good for your kidneys. So we take a lot of your nuts, because the nuts provides your unsaturated fat, because we need fat in our body. People all talks about fat. Yes, saturated fat you don't take much, but you need a bunch of unsaturated fat, especially fat from the plant-based. Avocado is very good. So after our morning breakfast, we do our morning work, and then lunch is between our 12 to 2. Actually 10 to 2 is your pitta time. That is your Tikhnagni, your digestive fire is very strong. So we eat our lunch. The lunch is our main meal. According to Yoga and Ayurveda, your lunch, we need all the 7 coloring fruits and vegetables, not the fruit, vegetables, and 6 taste. Astringent, bitter, pungent, salty, sour, sweet. The moment you put all the 6 tastes in your food, your whole food is all covered. We do not recommend eating fruit with your meal. Fruit has an enzyme called intestinal glycoprotein, which interferes with the absorption of your trace elements, and it also called cytochrome P450, which interferes with the metabolism of a lot of medication. If you are bound to eat a fruit with the main meal, eat the fruit first. And also in your meal, go from lighter to the heavier. So never have any problem eating. We prefer fruit as a snack during afternoon. Afternoon snack is a fruit, and again the fruit is all the 7 coloring of your rainbows. Violet, indigo, blue, green, yellow, orange, red. Same with all the vegetables, not only green and green, not only you have all the, we call it a rainbow colors. Evening, if you really want to do, which we all recommend you, to do a exercise. The difference between yoga and exercise is sympathetic. When you do exercise, your heart rate goes up, blood pressure goes up, respiratory rate goes up, you get a sympathetic overdrive. When you get a sympathetic overdrive, body's homeostasis starts activating your parasympathetic activation. This parasympathetic activation helps with exercise. So when you are running, when exercising, our heart rate goes high up. If you're in a treadmill, if you run, our heart rate goes up. We call it 220 minus your age. You subtract your age from 220, that is your maximum heart rate, and try to go to between 80 to 90% on that. But what is most important is when you stop, how fast it is coming down. So we look at your pulse, how fast it is coming down, that is your parasympathetic response. In yoga practice, it is purely a parasympathetic activation. So daily we practice morning yoga, relaxation response, parasympathetic activation. Every other day in the afternoon we practice your exercise. Exercise, we make really a point for your muscle strength training. So you are able to get into your weight training and normally able to get up more and more, sequentially increasing weight. Absolutely important. And also yoga practice. What is a wonderful practice is a hand strength. Like we do a hand strength like your called crane, bakasana, or hand strength like your peacock, Mayurasana, the hand strength. And also when you have an increasing hand strength, you have a better pranayama practice, pulmonary practice. And as you know, if you improve your lung function, your heart function gets better, your brain function gets better, your cellular function gets better. So able to improve your lung function. And so, and you will see neuroplasticity will set in. Like if you're doing it, we're training with your biceps. Say you are doing it, say 10 pounds. You with the 10 pounds, you hold it, you do the breathing. Like, you breathe in before a muscle contracts. Like when I do this muscle is contracting. So I'll breathe out first, I'll breathe in. During breathing out, I'm going to do like that. Breathe in, breathe out. Because when I'm breathing in, I'm getting more oxygen in, and muscle needs oxygen. Same thing when I do a triceps. Yeah, breathe in, breathe out. Breathe in, breathe out. You do push-ups, bench press also. If you do weights, breathe in, breathe out. So weight training is absolutely must for all the senior people. Muscle tone is wonderful for your living. If you see people, 80s, 90s, and 100s, they all do your weight training. Do a little treadmill if you're in exercise, or you go out for a walk, and you will be able to walk about a mile in less than 20 minutes. That means you will be able to walk average of 3.5 miles. And when you do in the treadmill, what you need to do is start slowly. You start at a 2.5 mile, then you slowly increase your elevation. And you look at your heart rate. 220 minus your age. If you're in 60s or 70s, it will be 150 maximum heart. If you can go up to 120, 125 or 130, that is good enough. But you sustain. Most important, sustenance. You sustain for about at least 20 minutes. So your heart is conditioned. What will happen when you put yourself slowly and slowly, 2.5 to 5% grade. You're tolerating very well, no effort in breathing. You can go 3 miles, 5%, then you go to 3.5, 5%, and then you stay in 3.5, start increasing your elevation. You do have to do it all through the effortless breathing. In a normal condition heart, when you start doing that, it will be very slow rise, and you sustain between 15 to 20 minutes. Then you stop it, the heart rate comes down. In a non-conditional heart, when you start doing the practice, suddenly heart rate will go higher. Then if you sustain it, you stop, it will take a long time to come down. So how fast the heart rate comes down is a sign of your health and cardiopulmonary function. Early dinner, we plan to have a dinner, we said within an hour after sunset or about 3 hours at least, if not 2 to 3 hours, sometimes 4 hours before going to bed. So if you plan going to the bed at 10 o'clock, you try to have your dinner by 7 max, and don't eat or drink anything after that. The worst thing we do, especially in the United States, you have a very early dinner. You'll eat a dinner 5:30, and before going to bed has a midnight snacks. Remember, if you eat something and go to bed, that food is not digested because your body is in a state of basically death. Sleeping means your body is dead, nothing is functioning. So all the food which is not being properly digested, that undigested food becomes your high cholesterol, high fat, high sugar, high uric acid. So once you get a digestion, proper digestion, all of them goes away. In Ayurveda they are called ama. Ama is called the mother of all the diseases. So after dinner, you have your evening activities. If you are in a prayer, you do your prayer, you do your daily routine, this to be done, do your studies, do your work, and go to bed by 10 o'clock. So once you go to bed by 10 o'clock, it is a very, very important. Something happened here. Let me see what happened. Okay. So, I'm going to finish it today, and hopefully you have enough information. And believe me or not, once you start doing all this stuff and go to bed by 10 and sleep like the way I told you to sleep, you will have a wonderful sleep. And again, sleep is not how much time you spend in the sleep. How much is your quality of your sleep? Sleep has two components. One is called REM, rapid eye movement. Another is called your non-REM. Rapid eye movement, REM is about 20-25% of your sleep, and non-REM is about 75% of your sleep. Rapid eye movement, your mind is still active, so that is not the sleep which causes any benefit for you. Non-REM sleep, in non-REM sleep, of which there are 4 stages, stage 1, stage 2, stage 3, stage 4. Stage 3 and 4 is the deep sleep. So when you put the tracker, health tracker, you take a look at it, what is your deep sleep. You really don't need too much. You may need a couple of hours, 2 hours of deep sleep, that is good enough. And it is not the sleeping 6 hours or 8 hours, it's how much you get a deep sleep. Even if you sleep about 6 hours, 75% will be your 4.5 hours, and then about 2 hours. Roughly 2 hours of deep sleep is good enough. Thank you again. If you have any questions and comments, please put it in the Facebook, and I'll be glad to answer. And let me know what you want to hear about it and what you want me to present. But this is SWASTHYA RAKSHA, maintaining of your health with a daily routine, is the yoga therapy treatment. Thank you for joining and listening.